Hi. Let us guess a very short period of time on something that I see happening on Facebook a lot and in comments and so when we have like maternity issues. I noticed a lot of patients would be commenting saying things like they wanted a C-section, the doctors didn't want to give them it, and they're upset, and valid concerns, but I just wanted to share my opinion on it and also some facts. And this would be that a C-section or a cesarean section is a surgery, right? It's not a small procedure, it's a very big one. It has a lot of risks and potential complications, as with any surgery. And I feel like people don't notice, they're not aware of this. So they probably see it as just a quick way to make the baby, less pain, but that's not necessarily true, right? That isn't true. I mean, persons might be saying, oh yeah, they go to the private hospital and they opt for a C-section and it was fast and easy, no biggie. But that is not true. And especially in the public system, you have to qualify for a C-section, right? It's not a case whereby you tell your doctor that you want one and you get one. No, you have to fulfill certain criteria. You have to meet the criteria for a C-section. So there's a checklist that you have to fulfill, and well, that's it, right? And then you would be eligible to have it done. So it's not just a case whereby because you feel like you need one or you want one, you're gonna get it. It doesn't really work like that. And the other thing that I wanted to say too is there are so many complications that can arise, as with any surgery, and I hope that persons are aware that you're signing up for that when you get this surgery that you want, right? There's a chance of infection, there's a chance of damage to your other organs during that procedure. There is pain, of course, lots of pain, right? And some mummies have back pain for months and months after. You've probably heard of that before. You won't be able to work for a period of time because you'll have to have bed rest. So there's that financial strain as well. You're gonna have that scar. So there's potential emotional strain if it bothers you a lot. That's just a few of the many complications that can arise, and there's some cases in which if the complications are so much, you might even need a hysterectomy. You might have to take everything out. So a C-section is not a band-aid to just fix everything, and I wish more people knew that, so they wouldn't be like so upset with their doctors for not jumping to it because they wanted it. Because doctors try to, well, the ones that I'm talking about to be the ones doing what they should, right? I can't talk for everybody. They try to pick the best possible avenue, direction for you. They would not want you to go under anesthesia and under the knife without sufficient reason. Because again, it might seem like a little surgery for you, but it's not. So they wouldn't want you to be exposed to all those potential risks and complications without good reason, or without it being like your last resort, right? So I hope this was helpful.